dangerous bill meant to protect patients from problem doctors became law earlier this year, but it won't help patients as quickly as lawmakers hoped. KXAN investigative reporter Matt Grant shows us how even after an investigation revealed incomplete disciplinary records, full transparency is still years away.
And good morning to everybody joining us on KXAN Live. I'm Will Dupree coming to you from the KXAN Live studio for our next episode of Inside the Investigations, where we're going to take an in-depth look at some of the biggest stories that have popped up in the last week that our incredible team here at KXAN has uncovered in the last week. And joining me, as always, is investigative reporter Kelly Wiley. Kelly, thank you for being here.
Thank you for having me.
It's always a good way to start the day. So just to remind everybody what this live stream is going to do and kind of the conversations you're going to have.
So the point of this is to give you an inside look to our investigations. All the time, we're working on small stories that help consumers. We're working on big stories that are talking about broken systems in our state and sometimes across the country. But this podcast this KXAN Live is really a good opportunity for us to show you the details that you don't always get to see play out on TV when we air these stories. So often, investigators are in our office talking about all the little things that happen that we hyperfixate on. And so this is your opportunity to come into our office, hear what we're talking about, and the behind the scenes look, I guess.
So let's get into it. Today we're going to be talking about an investigative series that led to a pretty big change at the Texas Capitol.
That's right. We've got Matt Grant with us today. Matt is an incredible investigator, so much experience. He's always helping us. But I'm so glad we're talking about this story in specific because I feel like you've been working on it since you got here.
We've been working on it for a long time. I think we're a year and a half and it's still ongoing, Kelly. And nice to be with you.
Maybe having a little audio issue. Let's see.
Can you not hear me?
Okay, now I can hear you. Yay. Okay, perfect.
Okay.
But Matt, just to stop you for a second, you have been working on this for so long. House Bill 1998, though, it creates stricter scrutiny over Texas doctors and creates new rules about how the state tracks instances where they've gotten in trouble. But it's important to point out this wasn't something that lawmakers just came up with. This was after extensive research on your part, on investigative producer Dalton Huey's part, and revelations that you made in those investigations. What did you find?
Right. So this is all about transparency and ultimately patient safety. So after the 5-year anniversary of the Dallas spinal surgeon known as Dr. Death, Dr. Christopher Duntsch, after he was sentenced to life in prison for maiming dozens of patients, we wanted to look at the system and see what, if anything, has changed in that period of time. So we used publicly available records, data from other state medical boards. We cross-referenced those physician names one by one with the Texas Medical Board's website. So doctors who practice in Texas don't have to just be licensed in Texas. They can practice elsewhere, or they can practice elsewhere and come to Texas. So there's a lot of crossover. So we looked up doctors who were disciplined in other states. Specifically, we were interested in doctors who've had their licenses suspended or revoked. And what we found was that there were at least 50 doctors that we could identify who were currently practicing in Texas who had their licenses suspended or revoked in other states. And in some cases, for instances where a patient had died. And we found pretty serious examples that we reported on. A physician who was intoxicated while performing surgery, for example. When you go to the Texas Medical Board's website, Kelly, if you want to look up your doctor or surgeon ahead of time, Texas Medical Board's website, and a lot of states do this, have a pretty nice feature. You can go online, you can type in the doctor's name, and it will say, it'll have a list of options. This, any medical malpractice investigations, any Texas Medical Board actions, any non-Texas Medical Board disciplinary actions. So you think you're getting a full picture of this doctor's history, and with that information, you can then, as patient and the consumer, make informed healthcare decisions. What we found in these cases, though, was that in the physicians we identified, they were showing a clean record on the Texas Medical Board's website, when we identified and knew for a fact that that wasn't the case. We brought that to the Texas Medical Board's attention. We brought it to lawmakers' attention. And one lawmaker, Representative Julie Johnson out of the Dallas area, she told us that this was unacceptable, that she was going to fix it. And this past session, she introduced a bill that did just that laid out a framework to address the problems specifically that we identified. And she found a sponsor in the Senate, Republican Bob Hall, and it passed overwhelmingly, and it went into effect on September 1st.
Which is amazing. It's so often we have lawmakers that feel the same way that Representative Johnson did, but they introduced the bill and it still doesn't become law. So this is an incredible accomplishment to see an investigation create change. The law took effect, but your story that you just published is about a discovery you made about how that bill may not be working in the ways that we think it is.
Right. It has some patient advocates concerned. So the bill will require the Texas Medical Board to publicize any information, disciplinary information it finds from out of state within 10 business days. It also requires every physician in the state to be enrolled in, it's called a continuous query. So the National Practitioner Data Bank, it's this federal database of all medical malpractice, doctor disciplinary records from physicians across the country. If a hospital suspends a doctor for more than 30 days, that gets reported to the data bank. The public, we don't get to see what's in there, but state medical boards do, and they can make decisions based on that. So the Texas Medical Board would be alerted when a physician's enrolled in this continuous query. Think of it like a 24/7 monitoring system. If anything happens out of state, if doctors convicted of a crime that's healthcare related or makes medical malpractice payments, they're found liable for harming someone, the Texas Medical Board would know about that immediately. And after they confirm it another way, they're supposed to make it public. The issue, though, Kelly, is that this isn't going to take effect, not just on September 1st. This isn't going to take full effect until the fall of 2025. The way that the law is set up, according to the Texas Medical Board, they're saying the funding mechanism is that so physicians will pay an $11 fee, either when they apply for a license or when they renew their license, and they renew every 2 years. So to get all physicians and physicians' assistants in the state of Texas enrolled in this continuous query, it's going to be a slow roll. It's going to take 2 years to get everybody enrolled. But patient advocates say that's too long to wait, that maybe it shouldn't take place day one because there are, they need to hire more staff to do this. There are mechanisms that need to happen. But at the same time, 2 years, they say, is too long. And they point to other states who have, if they're waiting on fees, but they're able to borrow from another regulatory agency and then pay that money back. So they're throwing out ideas and saying, why can't the Texas Medical Board enact this quicker? The Texas Medical Board says, well, this is how the funding is in the law, and we're following the law. So we reached back out to Representative Johnson's office, and her office tells me that they're contacting the Texas Medical Board and that they want to make sure that they have the resources needed to implement this law in a timely and effective manner. So we're watching and waiting to see what happens next.
Amazing. I mean, there's one thing we know about you. You're persistent, and you have, from identifying the problem to figuring out what's been done since, we first learned about these issues, to the bill being passed and becoming law, to now making sure that it's working in the way that advocates and patients want it to. You've been so persistent. I can't wait to see what else you find and what else happens with this. Thank you so much for joining us.
Thank you so much for having me.
And you can read Matt's full investigation on our website right now at kxan.com. So Matt Grant, thank you again for joining us. And before we let everybody go and enjoy the rest of their days, Kelly, I wanted to point out a story that you've been following very closely that is available for everyone to read on our website right now at kxan.com. And that's about what's happening with Austin ISD's Special Education Department and the Texas Education Agency. Remind us what happened last night. And again, people can read about this over on our website at the moment.
Well, The school board, Austin ISD School Board, has had a big decision to make that they've kind of been pushing off for the last month because of findings that the TEA made earlier this year about their special education program, finding over 40 violations of special education requirements. The state has said that they want to intervene in how Austin ISD operates their special education department. At first, they were recommending a conservator, which would be a state-appointed official coming in to tell Austin ISD how to run this department. But in recent weeks, or recently in the last month, TEA has kind of created this deal where they say, we'll give you a monitor, and that person will observe and report back to the state how you all are fixing and progressing these issues with special education. But as a part of that deal, there are several deadlines, several requirements, and they'd be waiving any ability to appeal or for any type of litigation if at any time TEA decided to bring it back up to a conservator. And so it's been a big decision that they've been weighing. But last night they voted. It was not unanimous. There was one lone school board member who decided to reject that deal, but it ultimately passed 8-1. And so now Austin ISD School Board has effectively agreed to have a TEA appointed monitor come in who will observe how they're progressing with fixing these issues. It was a very emotional night. We saw school board members give really impassioned speeches, some kind of choking up. I think they're very concerned about what this could mean going down the line. A lot of them expressed that they felt that this was the best path forward, but they're all very worried about any potential takeover. That's kind of the elephant sitting in the room, because this is not happening in a vacuum. They're watching what's happening in Houston ISD,
right,
which is not what's going on here. But I think they're very worried about what could happen down the road. So we've been watching it. We'll continue to update you, but a big decision last night made.
And I know you'll be following every new development that comes. You can read Kelly's latest reporting about that right now on our homepage at kxan.com. It's one of our most trending stories this morning, so if you want to take a look at that, it's right there. But as always, Kelly, thank you so much for being here and for bringing us that conversation with Matt Grand as well.
Thank you. I'm excited for next week.
All right, everybody. We will see you back here next Wednesday morning for Inside the Investigations. That's Kelly Wiley. I'm Will Dupree. We will see you back here another time. Hope you all enjoy the rest of your Wednesday. Take care, everyone. See you later.